People that undergo transnasal dilations, we begin by numbing the nostrils. We spray a 50-50 mixture of Afrin and 4% lidocaine in the nostrils and then pack it with cotton pledgets soaked in the same solution. We usually leave them there anywhere from 5 to 10 minutes. We lubricate the transnasal esophagoscope for ease of passage. In general, most of the time we go along the floor of the nose, and in this case it's wide open. A little bit of barium in there from her contrast swallow earlier today. She's got a very tight stricture, which you can note there. Barely able to get through it. There we go. Let's go ahead. In order to pass the wire, we put an inserter inside the esophagoscope, which you'll see here in a moment. And then we go ahead and place the guide wire. In order to remove the guide wire, one has to unlock and pull the guide wire free. We go with the floppy end first. When the inserter is in, it's important not to hit the water, or the air for that matter, because it'll shoot back at the endoscopist. Under direct vision, we advance this, and there's the wire endoscopically. And as that is being inserted, I slowly withdraw this as the wire continued to be inserted. We're past the stricture again. Go ahead and keep passing that. Got it. And then when one person secures this at the nose, this can be pulled free. The inserter is then removed. The inflation device itself is removed from its container. Fill it with sterile water or saline. There you go. And it's filled with between 40 and 50 cc's of fluid. We then connect the inflation device. And this allows us to apply negative pressure to the balloon as we remove the protective sleeve from off the balloon. Every balloon is marked with the atmospheres of pressure corresponding to the amount of dilation. For example, with the 10-12 balloon, 4 atmospheres of pressure will result in 11 millimeters of dilation. We usually lubricate the balloon and then insert the balloon over the guide wire. Sometimes the hardest part of the procedure. So we go in together so I can follow the balloon down to the area of the stricture. Easy breather, you're doing great. Okay, let's get the balloon down there. So under direct vision, we look at the proximal portion of the balloon, and then we can go ahead and proceed very gently with dilation. But one of the keys is very slow expansion of the balloon. So let's go ahead and very slowly. I'd go a little further in, Mike. Yeah, a little more. There we go. Slowly, very slowly. You lock the device, and then you use the screw mechanism to increase pressure. And then just tell us what pressure as you go. Tell us when you get to 2. Nice and slow. And you can go ahead and suck secretions or any bleeding with the scope as you're watching in place. But once you get to 2, keep going. Okay, we're now at 2 atmospheres or 1 centimeter dilation. Let's go to 4. That's 11 millimeters. Let's go to 6. Still doing okay? Mike, if you wiggle it, do you feel tight yet? No, nothing, is it? Good, well. Okay, so this is the maximum of this balloon. She's tolerating pretty well. We'll probably go to a larger balloon. Yeah. Deflation takes place. Then we can pull the balloon out, leave the guide wire in place, and go to a larger balloon. The different atmospheres result in different millimeters of dilation. And then we repeat the procedure, but now with the larger balloon. Once again, you're wanting to position the balloon at the area of the stricture. Advance a little more there. There's the blue down there. I think a little further. There we go. Okay, let's go ahead and begin inflation. Just like last time, nice and slow. And now use the screw part. Read the numbers as you go. I have a little bit of bleeding right there, kind of normal. How's it feel, Mike?
2.
I'd stop at 2 right now. Yep. Feeling that? How's that feel? A lot tighter than the other one? First with the balloon, we'll often pull it to and fro just to feel how tight it is. If it gets, particularly tight, if one can't move it and it starts to bleed, you've probably done enough dilation. I think a little more too. Let's go up to 3. And you keep the balloon under direct visualization. So right now we're at about 16 millimeters.
Okay.
Feeling all right? Let's go up to 4. 16.5 millimeters. Doesn't feel pretty tight. And you notice now when Dr. Yang pulls this, it doesn't want to really move in and out compared to the earlier catheter where it could slide reasonably easy. Let that sit there for a minute. And we maintain the pressure at 4. Screw. As the tissue stretches, the pressure will decrease. So you have to go ahead and use the inflation device to maintain the pressure at whatever you decide to set it at. I'm going to go ahead and let it down, but then let the balloon go in. I'm going to follow it and look around. That's significantly different right there. And that's the stricture open. Okay, let's come on out. Deflate it all the way. And we take it out.